I guess we're doing our second last lecture, which is on art therapy too. I don't know if you'd had a look at the deck that I shared with you. So we'll just whisk through it. So, first things first, I'll discuss how art therapy works, which is the formal way it works. I know last time we had mentioned that it can be done unconsciously by an individual, and also it can be done administered, right? So someone would administer it. So I'll take you through that. Um, we'll look at cases demonstrating just one case demonstrating the benefits of art therapy. We'll also discuss health issues treated by art therapy. There's also participants' evaluations of art therapy in drawing. Then we'll also look at situations where art therapy is practiced, the effectiveness of art therapy, and things to consider when someone is practicing art therapy, and where to find art therapy in Kenya. So, to begin, so definitely it is like any other therapy. So, it's really a relationship between a client as well as the therapist. And the idea is the therapist needs to work with the client to understand what's causing the distress, right? So, therapist normally guides the client to create some art that addresses this cause, right, of the issue. So, normally it's a sequence of activities. It's conducted within an hour to 2 hours, depending on how you plan your session with your therapist. But the idea is that the first thing will be to describe the goal of the therapy. This is usually done by the therapist. And then they would explain to the client, not to really think of themselves as creatives, but to see it as a process of how to overcome this distress that they're experiencing. And then they'll then ask the client to choose a medium. So whatever medium it's there, so it's always provided for. The therapist has all those necessary tools, for drawing, for collage, for painting. And then, of course, the client would then be guided on how to would just be guided on how to express their thoughts through art, right? So, and it's usually a line of questioning, like, okay, so what are you feeling today? Um, what is the issue? Draw something that shows what you're feeling, what colors are striking, or express what you're feeling, and so on and so forth. So it's really a guided process, right? Then thereafter, discussions ensue between the two, and then they look at the work as they assess it, and then they plan for the next session. And it goes on like that until, I guess, the client gets into a better headspace, right? So the goal of art therapy is to utilize the creative process to help people explore the self-expression, and in a sense they gain personal insight, right, about the issue, and of course they develop new coping skills to overcome this issue that they're experiencing, right? And as I mentioned the other time, some of the benefits of art therapy is you do explore your emotions because it's a form of self-expression. You develop self-awareness. You also are able to cope with the stress. It also boosts your self-esteem, and also it works on your social skills and many other things. So I think we discussed this at length, right? So some of the techniques that are employed are making collages. You could be coloring. You could be asked to doodle or scribble, draw, finger paint, even just actual painting. There's also photography. This one is not really common, but yeah, I've seen people do photography. Um, and then there's also things like sculpture. If you really like to work in 3D with clay or carving, that's an option, as well as using textiles. So these are just some of the ways that therapists would some of the techniques that the therapist would administer for the client to actually do their self-expression exercise. So apparently in 2016, there was a journal that published something very interesting. The journal is called the Journal of the American Art Therapy Association. They said that even just by doing art therapy for less than an hour, already clients would feel stress levels going down. They'd feel a positive effects in their mental health, And I guess this is just something to say that there's also been a lot of research going on that this is actually a helpful exercise. So it may sound like hogwash, but it's not. It actually is helpful. And if you go to any mental health institution, like a prominent one, even in Kenya, you see this being practiced, right? Yeah, even children usually do go through it. So this is not really uncommon. So, so health issues that can be treated by art therapy are many, from anxiety to depression to substance abuse to stress to post-traumatic stress syndrome, even ADH, which means attention deficient hyperactivity, can be treated by art therapy. Also, aging is now becoming an issue because, of course, we're moving from a young society to a middle-aged society. And in other markets, like in the EU, there's a huge aging population, and they do practice art therapy. In fact, if you look at countries like England, a lot of the aging population do practice art therapy unconsciously or actually deliberately by visiting a therapist. Also, it helps compassion fatigue. This is a term that describes the physical and emotional and psychological impact of helping others. So, this one is also a critical one. So, say you're a humanitarian, you work for an NGO in a very in a place that has war. So, for example, places like Afghanistan, Yemen, South Sudan, they're places that actually still have civil war or actual war, like Ukraine and Russia. Soldiers, particularly, as well as humanitarian people who provide aid, they normally have issues because they've seen so much trauma. So they too can actually undergo art therapy. So that's what I mean when I say compassion fatigue. Like, you've been helping people that you now are affected because you've been seeing a lot of trauma. So anyway, or you've been helping people and you're pitying people and so on and so forth. So anyway, so then there's also other health issues like heart disease, anorexia, bulimia, cognitive impairment, family or relationship issues, which is becoming more and more big one, because sometimes these family relationships affect particularly teenage children and teenagers. And then, of course, individuals experiencing difficulty discussing or remembering painful experiences like death, or you've gotten a certain disease that might impair you in one way or the other, right? So I'll just give you one case. So a case was done. So there are several authors who've written about the benefits of art therapy. So there's actually one case around a study that was done amongst 32 women aged between 49 and 54, and all of them had heart disease. This was in 2004. And what emerged was that they were basically told to draw, right? And the drawings, they had three categories: draw the heart as the center, draw the heart in the lived body, and draw the heart as a social illness. And you could see that these three themes emerged as a consequence. And I guess it's sort of like the way you do a formal analysis of people's art pieces. People, I mean, the healthcare practitioners were able to see that, you know, through the art of these women, they were able to see what they felt, about the condition that they were experiencing, which was the heart disease. So so it's very interesting to see that art therapy can express things that you may not necessarily be able to say, like verbalize, but it does emerge as themes on the artworks that are created. And the long and short of it is that while these women initially experienced a number of illnesses related to the challenges such as loss of confidence, loss of sleep, altered social relationships, the study reported that through art therapy, there was an increased focus on positive life experiences, increased self worth, maintenance of social identity, and an increased ability to express their feelings in a symbolic manner. So I think this is just to show that in some way and in some diseases, art therapy can help, right? I won't go into the details. So what I'll do is I'll just skip a few slides because I really want us to discuss the second deck. But let's just discuss situations where art therapy is practiced. So therapists if I mean, so the moment you want to see a therapy, you may be experiencing some of these issues. So right, so one would be an adult might be experiencing stress, whatever the reason. It needs to be severe stress, so you can see an art therapist. It could be that children are experiencing behavioral or social problems at school. So if you see a child who's having issues in school, and it's perhaps something that is brought about in the home, like say they don't like their home environment, or it could be even in the school, like perhaps they are bullied. Art therapy could be something that could resolve the issue, or at least bring forth what the issue is, because sometimes children don't like talking about what is happening to them. It could also be that a child or an adult has experienced a traumatic event. So normally you'll also see, like say you visit a hospital and you'll see couples or an individual told that they have a certain disease like HIV. That's like that's shocking news. So normally you'll see them actually see a therapist, and sometimes it could be an art therapist, right? Also, children with learning disabilities are encouraged to practice art therapy. Individuals living with brain injury is also good, for you to look into that, which is art therapy. And then also people experiencing mental health problems also do go through art therapy. In their centers, they have therapists. Now, there's a research that has been done that there's a disease called schizophrenia. Um, there are some researchers who've proven that art therapy doesn't help such patients. So there are some extreme diseases that art therapy may not help, and research has proven as such. But I guess, I think we saw in the last class that someone who had bipolar disease actually was being helped by practicing art therapy. So it just depends. For some, it's helpful, for some, it's not. And then finally, you could be an adult or teen undergoing rehabilitation. And this is also something happening common. It's very common in Kenya, where a lot of people are practicing substance abuse. So I think, in these rehabilitation centers, we are now starting to see art therapy also being practiced, right? So the next slide is around effectiveness of art therapy. So to be honest, this is a very new area, as I had mentioned earlier. The practice began really sort of formally around the mid 19th century, which is like 1940s, 1950s. So you can imagine, sorry, that's the mid 20th century. So you can imagine a lot hasn't been really explored around this industry. And so therefore studies have said that, the benefits are small and inconclusive. That has been, the verdict so far. Um, However, in studies of adults who are experiencing trauma, art therapy was found to significantly reduce syndromes and decrease levels of depression. So there has been some, sort of benefits that have been seen, and I think when it comes to trauma, it's been beneficial. Also, it's been helpful to patients who are undergoing medical treatment for cancer, and it's been known to improve their quality of life, right? And then another study conclusively said that art therapy really does reduce depression and increases self-esteem in older adults living in nursing homes. So I think these are like three areas where the effectiveness of art therapy is positive. And if I guess you know anyone who is is challenged in any of these three areas, you may want to recommend to them art therapy, right? Then things to consider, and I think this we've mentioned in the previous class as well, is that art therapy is not for everyone. Art therapy can cause harm. So, so I guess it's something that you test, and if it's not working for someone, just pull it away from them. If it's not helping them cope, then just leave it. And then of course, art therapy can take place in a variety of places, and we've discussed many, from the inpatient offices, these are, and medical centers, to art studios, to elementary school, to even homes for the elderly. So I think there's a lot there, right? Now in Kenya, finally, in Kenya, where you can find art therapy being practiced, and you may want to visit and see it happen, or at least experience it if you'd like to experience art therapy, formal one, is you can go to CBT Kenya, which is Cognitive Behavioral Therapy, Chiromo Lane Medical Center, Oasis Africa, Mental Wellness Initiative Kenya, and Koroma Art Therapy Network. Sorry, I have whisked through that presentation.